Hello, this is Dr. Do again. This video is on alphabetic list of problems. I think I have finished all the problems or concept started with letter I. Today I'm going to move to J. However, I think the most important, the most common associated problem with this J is the jaundice. And I just had another video talk about the ecteric and jaundice. So if you can follow that video. So then I'll just move on to the letter K. The first thing came to my mind on this letter K, associated with this letter K, either problems or any other concept, is the kidney. Even though I had previous videos on the glomerulonephritis or interstitial kidney diseases, but I still like to talk about the kidney in terms of at the organ level and also the diseases, pathological conditions. I just like to put everything together to talk about this kidney associated conditions, because kidney is such an important organ in the body. It's the solid organ. If we count the solid organ in the body, so the kidneys carry on so complicated functions. It's a complex of the physiological function units. So I like to spend a little time on this kidney. So first of all, let's start with this conditions associated with the kidney disease. Are there any emergency situation associated with this kidney disease that you need to visit the emergency? Of course, kidney disease can be very serious. Even though we have two kidneys, but sometimes a lot of systemic diseases affect two sides, not just one. Some of the diseases, for example, the blockage by the stone, usually occur only one kidney, but a lot of systemic diseases really affect both sides, bilateral. So if that's the case, will cause a lot of serious conditions associated with this kidney disease, either chronic or acute. Because the kidney is involved in the iron balance, acid-base balance, and excrete toxins. So if the kidney not function well, acute or chronic, will cause heart problem because imbalance of the irons. Hyperkalemia, for example, the potassium is so high, cause the arrhythmia of heart, could very serious, sudden death. Or the kidney cannot function to excrete the waste, then this waste will just circulate into the brain, cause the brain damage, encephalopathy. So that's also very serious. Patient might be in the coma condition. So and also the fluid accumulate back up to the heart can cause the heart failure associated with the other hormones regulated. So what are the signs associated with the kidney disease that you need to see the emergency room? Usually, if it is acute nephropathy, losing protein in short time, could be young or older, with or without systemic disease, it can happen. If that's the case, you feel swelling, probably woke up in the morning, you feel swell on the eyelid and the lower extremities. If that's the case, you need to see the physician right away. The sooner the better, to identify the causes and to treat. And also, if the kidney disease is associated with the blood in the urine, hematuria, so that's the case. It's also a quite urgent situation. Even though it's not life-threatening, but it's still quite urgent. You need to see a physician right away, as soon as the sooner the better. And the emergency situation, like I said, usually occur with those chronic kidney disease. Suddenly getting worse, the potassium abnormal, and also becomes anuria, which means the urine output is less, very minimal, or oliguria, or less urine output, and the swelling getting worse, or alter the mental status. All of those signs that indicate emergency situation. Go see the emergency as soon as possible. So having talked about this extreme, the emergency situation, any associated disease about kidney that you can manage at home? Probably not, unless the kidney stone, for example, falling, you drink fluid, you can flush it out. But usually it's not that straightforward, not that easy. The pain of the stone because stuck in the tubule structure is quite painful, so has to be managed by the physician. Use dilator to open it up, and the stone will pass down. So really, there's nothing you can manage at home. Any associated conditions with this kidney disease you cannot manage at home. So having talked these two ends of the conditions, let's just talk more about the kidney. Bilateral kidney in the posterior of the peritoneum, actually it's outside of the peritoneum, so it's called, and also in the flank region, the region is called the flank region, and on top of this kidneys are the two adrenal glands. So this is basically, and the kidney has the shape and the bean shape. There's a kidney bean shape, so that's exactly like the shape of kidney, and their structure of tubule open up to excrete the fluid, and also the waste is the pelvis. So then the kidney structure is fundamentally like this, the grossly look. And on top of this kidney, there's the capsules. This capsule is very important. Under this capsule membrane, there's some fat tissue, serve as the insulation or the cushion. So a cushion effect in terms of the mechanical force, so that serve as protection. And the kidney, the function unit of the kidney, I talked about that before, which is glomerulus, called glomeruli, multiple. However, the parenchymal cells of the kidney are not those glomeruli, because those glomeruli only the capillary web of the capillary wrapped by the capsules. So the really parenchymal cells in the kidney are the cubic cells of the kidney parenchymal cells. So if that's the condition occurred, so that's really the kidney diseases. It can cause very serious problem, because those cubic cells serving as absorption and excrete, so that and the ion exchange all occur in those cubic tubule cells. So those are the parenchymal cells, a different kind of a segment of the tube, serve as different function. I'm not going to go to the details of this function of individual tubules structure. But in general, the kidney disease the causes of a kidney disease could be the inflammation or the infection, or associated with the systemic disease, or idiopathic. There's another category of idiopathic. I'm going to break down individually either inflammation or the infection or the idiopathic, or associated with the other systemic diseases. So I'm going to talk about this individual category of the kidney disease in the next time. But this video just general introduce about the kidney and the function cells, and also the main structure. Even though the glomeruli not the parenchymal cells, but to carry on the most important function, the blood passing those webs of capillary to filter out in a huge amount, and then the cubic cells serve as the reabsorption to screen what can be passed out of the body, what need to be preserved to circulate back. So that's I'm going to talk about it next time. Thank you for watching. I will see you next time.